بسم الله الرحمن الرحيم. أبناء الطلاب وزملاء أطباء الدراسات العليا، يسعدني أن أقدم لكم هذه الأفلام التعليمية التي تتناول الجانب العملي لمادة التشريح. فنشاهد الآن هذا الشريط على أمل أن يحقق الفائدة المرجوة منه مع تمنياتي لكم بالتوفيق. يقول الله تعالى: وقل اعملوا فسيرى الله عملكم ورسوله والمؤمنون. صدق الله العظيم.
Anatomy of the lower limb, the front of the thigh. This is the front of the thigh. The covering deep fascia of the thigh is called the fascia lata. It envelops the thigh completely from the inguinal ligament above to the knee below. It is thickened laterally to form the iliotibial tract. This is the iliotibial tract. There are three intermuscular septa which extend from the deep aspect of the fascia lata to the linea aspera, thus dividing the thigh into three compartments. The first is the anterior compartment, which contains the extensor group of muscles. This group is supplied by the femoral nerve. The second is the medial compartment, which contains the adductor group of muscles and are supplied by the obturator nerve. The third compartment is the posterior compartment, which contains the flexor muscles that lie on the back of the thigh and are supplied by the sciatic nerve. The fascia lata shows the saphenous opening in the upper and the medial part. This is the saphenous opening. It lies 4 centimeters below and lateral to the pubic tubercle. Notice its margin, which is sharp above, laterally, and below, but not medially. The great saphenous vein hoops around its lower margin to end in the femoral vein, which lies immediately deep to the roof of the opening. This is the femoral vein, clearly seen in the opening. The roof of the opening is formed by the cribriform fascia, which is removed in this specimen. Cribriform means perforated. It is perforated by the great saphenous vein, by the superficial vessels, and by lymphatics of the groin. The superficial vessels of the groin are namely, first, the superficial circumflex iliac, which run laterally towards the anterior superior iliac spine. Second, the superficial epigastric run upwards on the anterior abdominal wall. And thirdly, the superficial external pudendal run medially to the external genital organs. Pudendum means genital organs. The lymphatics, which pass through the saphenous opening, connect the superficial inguinal lymph nodes with the deep lymph nodes. The deep nodes lie along the upper part of the femoral vein. The superficial inguinal nodes lie just below the inguinal ligament. Some of them are placed horizontally, and some are situated vertically along the upper part of the great saphenous vein. This is the inguinal ligament, which is the lower border of the aponeurosis of the external oblique muscle of the abdomen. Aponeurosis means a wide tendon. This aponeurosis is perforated medially by the spermatic cord, which descends into the scrotum. This is the spermatic cord. The inguinal ligament is attached along its whole length to the fascia lata of the thigh. Superficial to the fascia lata, there is the membranous layer of the superficial fascia. This is the membranous layer of superficial fascia. It is covered by a fatty layer. This membranous layer of superficial fascia is continuous with the membranous layer of superficial fascia of the abdominal wall above the inguinal ligament. This membranous layer is fixed to the underlying fascia lata along a horizontal line which extends laterally from the pubic tubercle just below the inguinal ligament. Below this line, the membranous layer is not fixed to the fascia lata, thus making a space in between. Above this horizontal line, the membranous layer of the anterior abdominal wall is making a similar space between it and its underlying deep fascia. The membranous layer of the thigh is fixed medially to the side of the pubic arch. When the male urethra ruptures widen the perineum, the accumulating urine cannot pass to the thigh but ascends into the space underneath the membranous layer of the perineum to enter that of the abdominal wall. This fluid accumulating underneath the membranous layer of the abdominal wall cannot pass into the thigh because of its fusion just below the inguinal ligament. This is the femoral sheath deep to the fascia lata. It covers the upper 3 centimeters of the femoral artery and femoral vein. This is the anterior wall of the femoral sheath, formed by the fascia transversalis. The posterior wall is behind the femoral discs and is formed by the fascia iliaca. Now let us move to the left lower limb. The upper third of the front of the thigh shows the femoral triangle. This triangle is bounded laterally by the sartorius muscle, medially by the adductor longus muscle, and its base is formed by the inguinal ligament. The apex of the triangle is directed downwards where it is continuous with the adductor canal to the middle third of the medial side of the thigh. The femoral triangle has a roof formed by fascia and a floor formed by muscles. In the roof, several cutaneous nerves run. These are the intermediate and medial cutaneous nerves of the thigh. The lateral cutaneous nerve of the thigh does not run to the roof of the triangle because it appears behind the inguinal ligament just medial to the anterior superior iliac spine and descends in the thigh lateral to the sartorius muscle. This lateral cutaneous nerve of the thigh is not a branch of the femoral nerve but arises directly from the lumbar plexus. However, the intermediate and the medial cutaneous nerves arise from the femoral nerve. In the roof of the triangle lie the great saphenous vein and the superficial inguinal lymph nodes. The following structures are the main contents of the femoral triangle. First, the femoral artery and the vein and their branches. Second, the femoral nerve. Third, the femoral canal. This is the femoral nerve. This is the femoral artery, medial to the nerve. This is the femoral vein, medial to the artery. This is the femoral canal, medial to the femoral vein. The upper 3 centimeters of the femoral artery and the vein, but not the femoral nerve, are surrounded by the femoral sheath. This is the femoral sheath. It is formed of 2 layers, anterior and posterior. The anterior layer is formed by the fascia transversalis, which descends from the anterior abdominal wall in front of the vessels. The posterior layer is formed by the which descends from the fascia covering the iliacus muscle behind the vessels. The space within the femoral sheath is divided into 3 compartments by 2 septa, which extend between its anterior and posterior walls. The 3 compartments are lateral, intermediate, and medial. These are the 2 septa, 1 lateral and 1 medial. This is the femoral artery lying in the lateral compartment. This is the femoral vein in the intermediate compartment. This is the femoral canal in the medial compartment. The femoral canal is a canal leading to the abdominal cavity, and it is shut off from above by a mass of extraperitoneal tissue called the femoral septum. The femoral canal lies over the pectineus muscle and its fascia, which is named pectineal fascia. The entrance of the femoral canal into the abdomen is called the femoral vein, which is bounded laterally by the femoral vein and medially by the lacunar ligament. The lacunar ligament is a part of the inguinal ligament. It has a sharp 3 lateral margin, and the abnormal obturator artery may descend in 30% of cases just behind this free ball. The femoral canal is wider in females than in males because they have wider pelvis. The femoral canal is a route for the femoral hernia, which descends through the canal till its end in the saphenous opening. Then the hernia comes out through the saphenous opening, pushing its cribriform fascia upwards and laterally towards the anterior superior iliac spine and just below the inguinal ligament. Notice that the femoral sheath does not contain the femoral nerve, which lies outside it. This is the femoral nerve. The sheath ends about 3 centimeters below the inguinal ligament by fusion of its walls with the femoral vessels. The sartorius muscle arises from the anterior superior iliac spine and descends obliquely downwards and medially in front of the thigh, forming the lateral boundary of the femoral triangle. It continues on the medial side of the thigh, where it lies on the roof of the subsaltorial or abductor canal. The sartorius is inserted below into the upper part of the medial surface of the tibia, together with the two other muscles named the gracilis and semitendinosus. The three muscles lie superficial to the tibial collateral ligament of the knee. The muscle is supplied by a branch from the femoral nerve. This is the branch of the femoral nerve entering the muscle. This is the tensor fasciae. It arises just lateral to the origin of the sartorius. It arises from the anterior 5 cm of the outer lip of the iliac crest and descends lateral to the sartorius to get inserted into the anterior border of the iliotibial tract. Actually, the muscle lies in between the two layers of the iliotibial tract and does not extend downwards below the upper fourth of the thigh. It is supplied by the superior gluteal nerve. Note that the posterior border of the iliotibial tract gives insertion to most of the gluteus maximus muscle. The tensor fasciae lata and the gluteus maximus pull on the tract, making it tight during extension of the knee. Notice that in the interval between the upper part of the sartorius and tensor fasciae lata, notice that in the interval between the upper part of the sartorius and tensor fasciae lata, the tendon of the rectus femoris muscle lies. This tendon arises by two heads: a straight head from the anterior inferior iliac spine and a reflected head from a groove just above the acetabulum. The rectus femoris muscle is ahead of the quadriceps femoris, and the remaining three heads are formed by the three vasti. This is the vastus lateralis muscle. It lies deep to the iliotibial tract. This is its nerve supply, which is a branch from the femoral nerve. It runs in company with the descending branch of the lateral circumflex artery. The vastus lateralis and the rectus femoris muscles overlap the vastus intermedius muscle. This is the nerve supply to the vastus intermedius. It comes from the femoral nerve. This is the vastus medialis muscle. And this is its nerve piercing it. It is again a branch from the femur. This is the medial side of the vastus medialis, showing its nerve entering its substance and the direction of its fleshy fibers. The fleshy fibers of the vastus medialis reaches down to a level lower than that of the vastus lateralis. The lower fibers of the vastus lateralis are more vertical, while those of the vastus medialis are more horizontal. These are the lower horizontal fibers of the vastus medialis, which are attached to the medial margin of the patella. These fibers prevent lateral displacement of the patella during extension of the knee. The vastus medialis forms the lateral boundary of the adductor canal. The quadriceps femoris muscle, as a whole, is inserted into the patella, and from the patella to the tuberosity of the tibia through the ligamentum patelli. This muscle is the only extensor of the knee joint, as opposed to the three hamstring muscles situated on the back of the thigh, which are the flexors of the knee. These are the muscles of the floor of the femoral triangle. They are from lateral to medial, the iliopsoas, pectineus, and adductor longus. This is the iliopsoas. It is formed by both of the iliacus and psoas major muscles and is inserted into the lesser trochanter of the femur. It is the main flexor of the hip joint, as opposed to the gluteus maximus, which is the main extensor of the hip. Notice that the femoral nerve appears behind the inguinal ligament and descends on the surface of the iliopsoas. The femoral artery also descends in front of the iliopsoas, which intervenes between it and the hip joint, that is to say, from the head and neck of the femur. This is the pectineus muscle, just medial to the iliopsoas. It arises from the pectineal surface of the superior ramus of the pubis and from the pecten pubis. It is covered by pectineal fascia and is related anteriorly to the femoral vein and femoral canal. It is inserted in of the spiral line extending from the lesser trochanter to the linea aspera. It is supplied by the femoral nerve and by branch from the obturator nerve. This is the adductor longus muscle, just medial to the pectineus. It arises from the front of the body of the pubis, just below the pubic tubercle. The gracilis muscle lies medial to it. Therefore, the adductor longus lies at its origin between the gracilis medially and the pectineus laterally. The adductor longus is the most superficial muscle of the three adductors. This is the adductor longus. This is the adductor brevis. And this is the adductor magnus. All adductors are supplied by the obturator nerve, and we shall come to this soon in more detail when we describe the medial side of the thigh.